Ως αιματολόγος, γιατί αποφασίσατε να ασχοληθείτε με την COVID-19?
So we work on COVID as an hematologist because we are interested in thrombotic disorder. And in fact, in the first patient in February 2020, we observed a huge number of thrombotic events. And in fact, we observed abnormal coagulation that could explain this thrombotic disorder, in particular in critical form of COVID-19. And in fact, now we know that this increase of coagulation, activation of coagulation, is a result of a real vascular disease after COVID infection.
Ποια είναι τα νεότερα για τη θεραπεία αυτής της αγγειακής νόσου?
After this observation of vascular disorder and coagulation abnormalities in COVID-19 patients, we tried several strategies of anticoagulation in COVID-19 patients. And now we know that critical form of COVID just do not have to have like a strategies of anticoagulation with high level of anticoagulation. So they have just a prevention of coagulation in a classic way. But for the minor form of COVID that need oxygen and we are hospitalized, now we know that more than corticosteroids that has been described as a good strategies to treat COVID-19 dependent of oxygen, we can use high level of anticoagulant in medical ward, and now we know not in critical form of COVID-19.
Από την αρχή της πανδημίας μέχρι σήμερα, τι έχει αλλάξει σχετικά με τις γνώσεις μας για την νόσο και επίσης τι γνωρίζουμε για τη long COVID-19?
Yes, for sure. This COVID-19 has changed a lot during the different waves of COVID. The virus is different. We have different form of virus, and more than that, we have antibodies. We have vaccination that has been a huge effort done, and so the disease now is very different from the first wave. What we can say now, we have, thanks to vaccination, less critical form of COVID, and probably with a new treatment and the corticosteroid, we have a decreased number of thrombotic events. One word in long COVID, because it's a huge problem of health now with the long form of COVID and the respiratory consequences of this COVID-19. And we probably have a different form of consequences of COVID, and we are still working on studying vascular disorder and abnormal coagulation that can be observed in some patients, in particular with patients with respiratory disorder 6 months or 1 year after acute COVID-19.